Hello, one and all. When you come to the hospital because you are pregnant, one of the things you're going to be very familiar with is your midwife or your doctor. Every time you come, they are checking the growth of your baby. Okay, because in actual fact, knowing the size of the baby, okay, can actually give a lot of information with regards to the well-being of the baby. For example, if your baby's very small, something could be going on. It could mean you need further investigation. But you know something, we're not talking about small baby today. We are going to talk about if you are having a beautiful, larger baby. Okay? So, what does it mean if you're having a larger baby? Oh boy, do you know something, especially if it's your first baby, must be quite scary if you go and the midwife measures and she says, oh, your baby measures like it's quite large. What I'm going to do is send you for a scan, and you go for a scan, and you think, oh no, because then the sonographer says, yes, you know, your baby is measuring up quite a good size. Go back to the midwife, and the midwife makes you an appointment with a consultant because now you're having a bigger baby. And what are the worries? What are the concerns if you're having a bigger baby? What are they scared about? Of course, they're not scared, but they know that there are risks associated with you delivering if you are having a larger baby. That just because there's risks associated does not mean you will experience those risks. Lots and lots of beautiful ladies go ahead and give birth to larger babies vaginally without any complications. But that doesn't mean there isn't a risk. That doesn't mean there isn't a risk involved. And the risk, in actual fact, is something that's called shoulder dystocia. Now, what that means is when you are giving birth, okay, your beautiful baby's head is delivered and the baby's shoulders can sometimes get caught. Now, for you as a beautiful lady giving birth, if that happens, you will need assistance because they will then have to help and assist to get this gorgeous baby to be delivered. And that can, for you, be quite traumatic. And that's what they want to avoid. Your problem is they don't know who's going to go on and experience this. So they can only practice based on risk. One of the things that they do, okay, is one of the measurements that they do, especially on the scans, they do what's called the abdominal circumference. You'll see it on the scan report. If you look on your scan report, you will see them documenting the size of the baby's abdominal circumference. Okay? Now, the reason they check on the baby's abdominal circumference is because it gives them an indication as to the size and the width of the baby's shoulders. And with shoulder dystocia, it's the baby's shoulders that can get caught. And so this is what they assess. So what are they going to do about it? What are they going to do about it apart from scare you? Which really and truthfully isn't something you should be. Like I said, lots and lots of lovely, lovely ladies go ahead and deliver vaginally nice, beautiful, normal, uncomplicated deliveries and have large babies. But the doctors will still know of the risk and they will still say to you, okay, do you know what? You're having a larger baby. Now, they will explain to you about shoulder dystocia, but they will also say to you, okay, you can, if you wish, go ahead and try for a nice, normal vaginal delivery. Obviously, if they are finding that your baby is very large, they may very well not recommend that. Okay? But chances are they will. The chances are they will say to you, you know, you can, if you choose to, go ahead and try for vaginal delivery. And we will be there to support you and we will be ready. Okay? They may also say to you, do you know what? Actually, your baby's really measuring up a good size. And yes, at this point, let's see, you're 39 weeks, chances of you having a vaginal delivery without complications are reasonably good. But we don't want you really and truthfully to continue with the pregnancy, because if you continue with the pregnancy, your baby will continue to put weight on, your baby's size will increase, and the problems, the risks will increase. So maybe they may suggest to you, do you know what? Let's book you in for an induction. It's not common, but sometimes they may in actual fact offer that you actually have a cesarean section. But this isn't really very common, but they may make that offer to you. This is going to depend on a lot of factors, okay? But it's down to you. All of these things, these choices are down to you. So it's really and truthfully, they know the risks. They will discuss with you, but you also need to be able to talk to them. You need to be able to ask them, okay, do you know what? I really want to have a vaginal delivery. How do I go? What's my best options? You're saying you want to give me an induction in a week's time, but you know what? What if I didn't have an induction? What are my chances? You need to discuss with them. This is going to be between you and them. This is very personal, based on all your past experiences, all your history, and all the findings that they have today. Talk to them, ask them, weigh it up for yourself, and then you make the decision. Okay? Hope this has been helpful. Have a good day. Bye bye.